Chair Garlick, Senator Lewis, great to see you. Members of the committee, it's truly an honor to be here with you today. My name is Carson Domey. I'm from Bellingham, Massachusetts, and currently attend the University of Texas at Austin. Like Caroline, I have the pleasure of working with the Massachusetts Association for Mental Health on this critical topic of expanding access to mental health education. In the fall of 2018, during my freshman year of high school, one of my closest friends died by suicide. This was a kid who, like many who share his story, had the brightest smile in the room and was always looking out for his friends. Though I always believed in the importance of mental health and its intrinsic relationship to your physical health, this experience and the subsequent impact it had on our community made myself recognize that our society is not doing enough to support the mental health and well-being of our young people. According to the National Alliance on Mental Illness, 1.15 million adults in Massachusetts live with a mental health condition. For reference, that's 6 times the population of Worcester. Furthermore, studies reveal that nearly half of Americans do not seek treatment for mental health conditions and often delay seeking help for an average of 11 years. These statistics serve as a wake-up call for the urgent need to educate students about their mental health, and House Bill 497 and Senate Bill 240 have the potential to do such and make a substantial difference in the health and wellness of the generation to come. This legislation will incorporate mental health education in the physical education curriculum, creating a partnership with our educators to equip youth with the essential skills to assist in managing their own well-being while simultaneously fostering a culture of support within schools. As Jessica LaRochelle and Courtney Cello will outline, the time for this legislation is truly now. A recent study published by the CDC reported that 1 in 4 people ages 18 to 24 have seriously considered suicide within the past 30 days. I want to challenge you to reflect upon that statistic the next time you visit a school in your district. This bill has the opportunity to change the way that we talk about mental health for the generations to come, paving a healthier and brighter future for millions, which is why I ask you to join us in supporting House Bill 497 and Senate Bill 240. Thank you very much.
Chair Garlick, Chair Lewis, and honorable members of the Joint Committee on Education, thank you for the opportunity to testify today. My name is Caroline Hanson. I'm a freshman at the College of the Holy Cross. My hometown is Lowell. Today I'm here to testify in favor of bills Senate 240 and House 497. Mental health education in schools is more necessary now than ever. Society's youth not only needs to be educated, but deserves to be educated about this topic. A detrimental stigma has surrounded mental health conversations for years, especially when talking to children. My entire life, I've struggled with anxiety. It complicated my daily life for as long as I can remember, school always being the most affected. Whenever I had to leave class due to an anxiety attack, or when I was dismissed from school for therapy appointments, I was questioned by my fellow classmates who had no clue what was happening, and who's to blame them. They had never been exposed to conversations or educated about mental health in any capacity. I sat through years of health class where we learned about cancer, smoking, eating healthy, and exercising. It confused me because we were learning so much about our physical health, but absolutely nothing about our mental health. I will share one more example of when I knew that we needed to do something about mental health education for students. I lost my dad in 2018 when he unfortunately died by suicide. I was 13 at the time, and my younger sister was only 10. An incredibly complicated loss made even more confusing by the lack of education we had previously been exposed to. When I returned back to school, my classmates asked a million questions about suicide, how it happened, and why it happened. I felt responsible for educating them on this topic, as I was in the process of educating myself. The bills being heard today are incredibly important to the wellness of students. Mental health education at all grade levels is necessary as the number of young people suffering from and affected by mental health issues continues to rise. These bills have the ability to change the lives of the students of Massachusetts for the better, teaching first graders that keeping their minds healthy is just as important as keeping their bodies healthy, or teaching high schoolers how to respond to a friend considering self-harm. Education is the most important. In closing, thank you to Chair Garlick, Chair Lewis, and members of the Joint Committee on Education for the opportunity to speak here today.